On this episode, emotions are running high
I can just feel how much turmoil she has.
as Scott struggles to calm an extremely agitated Daisy.
My little cutie girl.
Audrey and Alison meet a little dog
Oh my God.
with a very big problem.
Nobody wants to go to surgery, but in this case, it's a must.
And a not-so-friendly welcome as Rob attempts to treat a big cat.
Boy, you get the feeling, it shakes you down to your toes.
You make my world a better place.
Come on, there's your girl.
I can depend on
Come. Good girl.
In Richmond in southwest London, Tracy is bringing 18-month-old Daisy in to see Scott.
Here we go. Here. Daisy, here. Hiya. Should we give you a bit of air? First of all, it doesn't help, does it? Here.
Young Daisy is extremely scared of men.
I think it's more fear with her than anything, but I suppose as she gets older, she could turn it into aggression. No. She's going to go for it, and no matter what. So that's what we've got to train out of her now.
As well as help with Daisy's temperament, Tracy's concerned about another worrying issue.
I was going to say that's unusual. She likes postmen. It's only just recent we've noticed she was licking her paw quite a bit. So I looked at the other side and you could see there's like a little lesion, little lump. She's not going to relax now. She's watching everything and yeah, she's heightened. Anxiety's kicked in. Good girl. Stay.
Good morning.
Hi.
Hello, you seem very friendly.
Scott's going to have his work cut out to win over this feisty customer.
Okay. Hi. Yes. Oh dear. I've not even done anything yet, have I? Hi. Yes. Hello. Oh, yes. Okay. Okay. Daisy is really turning it on and she is really going at me. And it is, of course, a little bit scary. You know, you've got a big dog with a muzzle on going at your face. There's some serious mixed messages there, isn't there? We've got a very aggressive stance and a waggy tail.
Waggy
Haven't
tail,
we?
so yeah.
You're a mixed up girl, aren't you? Hey? Hi.
Okay.
Tracy's extremely scared her beloved Daisy might be beyond help.
I can't enjoy her and she can't enjoy life. I want her to be approachable. I'm not sure if it's going to be fixable.
Hello.
It's okay. Good girl.
It's okay. It's okay.
Daisy, stop.
Okay. Oh dear.
You're a good girl, aren't you?
In Bondi, Lynn has brought 2.5-year-old Miko to see Kate.
You're going to go in there in a minute. Yeah, that's a good girl.
The Australian Shepherd is suffering with an angry, painful right eye.
She got into a game with the Border Collie and the Border Collie's only a pup and got excited and scratched her eye and she just immediately, you know, closed the eye, so it was a bit frightening.
Hello, good girl. How are you? You go first. Hello, darling. How are you?
Oh, do you want to say hello?
It's a very sore eye.
Lynn is babysitting Miko for daughter Isabel.
I got Miko when she was 8 weeks old, so like the very second that you can get her, I got her. I always wanted a working dog. They're super smart and super loving and yeah, I just wanted all of those elements in one.
Tragically, Isabel lost her previous puppy Cora from heart failure at only 12 weeks old.
Her body was just not working for her. And Kate told me that she had about 3 months to live. It was heartbreaking.
Kate shared Isabel's heartbreak, so today she's hoping Miko's story has a far happier ending.
Our ouchies.
Yeah, she was playing with a border collie. The border just went on her nails.
Okay. When it comes to eyes, we're pretty precious about them. Eyes can go bad very quickly. At risk is their vision, so particularly in a young dog, it's always concerning. When was it?
Last night.
Okay. And is that better, worse, or the same?
Better.
Okay. You need to act on eyes reasonably quickly, and the fact that Lynn even says it happened yesterday and it was worse yesterday just makes my stomach churn.
Yeah, she just immediately closed her eye, and when I opened her eye, there was just the white, cover of the eye. I thought she'd lost it for a minute.
Ouch. And has she been going well otherwise?
I mean, she was very sooky last night.
Okay, little monkey. We're going to just put some little local anaesthetic in your eye. Good girl. Such a good patient. Both of these globes look normal. The next thing that we need to look for is that does she have a corneal ulcer? So is her cornea damaged on the outside? Because if we miss an ulcer, this is the difference between her losing an eye and not losing an eye.
Oh, you want a belly rub, do you? Oh,
Always.
always.
Now we're just going to put a little dye into her eye, and what this dye does is it just looks at the front of the cornea. Well done.
That's it.
So we need to turn the lights off, we need to use a special little light so that we can actually see that stain. What's really difficult in Miko's case is that your third eyelid has prolapsed out, and it's actually obstructing my vision to be able to see if there's anything wrong with this cornea.
I know. It's okay.
Very sore, is it?
It's okay.
It is very sore under there. The worst thing that could happen is that she does lose her eyeball, and we don't want that. If I can save this eye, it's going to be saved. There's something going on under that third eyelid, and I suspect it's actually the third eyelid itself that's injured. We might just have to give her a little bit of sedation just to see if I can't actually have a look under that third eyelid.
Sure. All right, my sweetheart.
Kate will need to sedate Miko so she can better inspect the eye.
It looks like it might be worse than I'd actually thought it might be, so at the moment I'm nervous, we just have to see.
It's okay. It's okay.
We just got a call from Donna Wilson at Zambie Wildlife Retreat.
Rob is answering an SOS about an hour west of Sydney.
Donna said she's very worried about one of the lionesses has a tumour that she's been watching for a while, but seems to have gotten very angry. So let's get out there straight away and see what we can do about it. Hello, darling. She knows me, all right. Look at her. Yes, it is me. It's the vet. I know. Oh, you're gorgeous. I don't know anyone that doesn't feel the roar of Jaya. Yes, you hear it, but boy, you get to feel it. It shakes you. It shakes you down to your toes.
Before treating Jaya, he meets up with Donna, the owner of Zambie Wildlife Retreat.
Hey, Donna. Oh, God. Good morning. How are you?
Hey, darling.
Good to see you, sweetheart.
I've brought Dr. Rob out to Zambie today because one of our old lions, Jaya, has got a really suspicious lump that started as a little hole and it's gotten a little bit bigger, and I'm a little bit concerned about it.
Let's
go and have a look at Jaya.
Let's do it.
Jaya's a beautiful lion. Look, she'll be 19 next month. She's one of our oldest animals here, and she has got a bit of sass about her.
We've been monitoring this little lump on Jaya for a little while. It wasn't too much, it didn't look too bad, but Donna said it's exploded out, it's looking really bad.
Before Rob can start, Jaya needs to be anaesthetised with a tranquiliser gun. Trainee Jared is ready to help.
Just go back out there. I'll see if I can keep it quiet here. She keeps turning away from the gun.
That's it, Jared.
There's the shot. Jared did an excellent shot, right into the muscle. It's discharged. We'll wait and see if it knocks her out with one dart or if she needs two.
Oh, yes. Okay.
In London, Daisy isn't having a bar of Scott, who needs to check out a worrying lump on the young Rottweiler's paw.
Daisy, sit. Good girl.
Daisy is quite fearful of men, and that has come from the fact that as a 5-month-old puppy, unfortunately she broke a leg and needed surgical intervention, and the vet that did it was a guy. This dog has now realized that any guy could be a potential threat, and that's exactly the way that she approached meeting me. So should I be taking this personally, Tracy, or is it a guy thing, or what is it?
It's a guy thing, and I think until she gets used to you, that would be
What I'll get?
a bit of both, really. I think it's just reactive. It's new voice, and you're a man.
Yes, sorry. I might just use my home court advantage and get you into the consult room.
Okay.
And we'll just see if we can get to know each other without all that shouting. You're a very anxious, mixed up, emotional girl, aren't you? With big teeth. Doesn't matter. Oh, let's come this way. Come this way. Okay, I'm crawling. I'm crawling. There we go. I rarely crawl about the veterinary practice, but when you have a patient that is intimidated by big people, by men, then you want to try and make yourself small, reduce their fear and allow you to engage with them. She's trying to engage me and I'm just not letting it. She's trying to look me in the eye, which is not normal behavior in dogs.
Yeah.
Actually, they're all deferential, they look at me. So I'm just looking away at the moment because I'm not trying to have a fight with her. Whenever I'm dealing with a very aggressive dog, I never try and overpower them. I actually try and be quite submissive to them to make them appreciate that I'm not a threat. It's all right. I stay very calm, keep my hands to myself and just bide my time. And over time, slowly get to the point where I can actually touch her. It's just incredible mixed messages because we've got shout, 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 go away, 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 and then the tail's like, oh,
wagging.
actually, hello.
Yeah.
It shows alertness, and a wagging tail doesn't always mean a happy dog.
No.
It's actually a big mistake that a lot of people make to their detriment.
After the operation, she kind of changed because she was fine before that, but then you don't know. She was 5 months then when that happened. Is it because she's growing up and it's come out in her more, or is it because something traumatic happened and she's got an anxiety now with that and strangers? So yeah, it's
Daisy and Tracy have had a really tough start to their relationship. Daisy was a pandemic puppy, then she had the broken leg, and then because of the pandemic, there really was a lack of professional behavioural support.
Do you think the anxiety is within the breed then, or is
Yes.
it? Yeah.
I worked with a dog called Digby.
Yes, I remember seeing Digby.
Okay. All right, I know. It's a little forward, wasn't it, mate?
I thought, gosh, that's just great. You know, I know there's someone around that could give me some ideas and be patient with her if I needed to.
Whoa, whoa, whoa. It's okay. All right, settle down. I'm not doing anything. I'm not going anywhere. So Digby was about twice the size, and may I dare say, Daisy, 3 times more scary, easy.
Good girl.
The anxiety means that they then use the powerful gifts that they've been given anatomically, and that comes with significant danger.
Yeah. I mean, she's a big
really
pussycat with us at home and the grandchildren. It's just anyone she doesn't know.
And, you know, there's got to be a level where you're sort of disappointed, I suppose, disappointed for yourself and disappointed for her that she can't live a happy life.
Yeah, yeah, and the timing was so against us. I was so angry. I kept thinking, God, you know, is this it? You know, we're not going to be able to take you, walk you, enjoy you, you know, like we should be able to, but...
Well, you know what? The pandemic is over, apparently. So now we can work together and try and make a difference.
Yeah, that's great.
I can't help but have a little bit of a tear in my eye for the situation that Tracy and Daisy find themselves in, because I can see that this is all bravado and this is a lovely dog that's really important to this family. But she's struggling, and Tracy is as well, and I'm really glad I'm here to help. Oh, thank you for my kisses. That's nice. See, oh, bless you. I feel for her so much. I can just feel how much emotional turmoil she has. She makes me feel a bit tearful.
Yes.
Because you can just feel it. Oh, baby.
Good girl.
Excellent. Really well done. That's great.
Finally, Scott appears to be making some headway. But will it last?
There's something going on under that third eyelid, and I suspect it's actually the third eyelid itself that's injured. If I can save this eye, like it's going to be saved.
In Bondi, Kate is trying to find out if a tussle with another dog at the park has left Aussie Shepherd Miko with a ruptured eye.
1 and 2 and 3.
A ruptured eyeball is when the inside of the eye is on the outside. Vision loss is inevitable if you have a ruptured eyeball. So you can see like how red this eye is compared to this eye.
So sore.
Ow. So we've put some local anaesthetic in the eye. That's taken effect, which has been really helpful, particularly for pain relief. And then we're going to stain this eye up again. Are you right there?
Yeah.
And we're going to actually have a look to see that there's no corneal ulcer there. Let's just pick this up.
Miko, well done, well done.
There is no ulcer on that eye.
Thankfully, the eyeball hasn't ruptured. Kate now suspects it's Miko's third eyelid that's copped the damage.
Is that cut down in here? But it's on the other side?
Yeah.
So essentially probably where that puppy has like actually caught the third eyelid and like scratched down. Well done.
Next, Kate is checking the pressure on the inside of Miko's eyeballs.
And what I'm actually looking to rule out here is that she doesn't have glaucoma. Red, painful eye, it's really important that we rule out all other things. You don't want to miss something. And imagine if you missed a glaucoma when you had the tools to be able to diagnose it and you didn't do it. 10, 10, 9.
Kate starts with Miko's injured eye.
Wow, she's really low. She's 9.
It's very low.
It is.
Now a check of Miko's good eye.
16, 17. Okay, so that's normal. So it has to be just a traumatic uveitis.
Kate has ruled out glaucoma, but the injury to Miko's eye has caused uveitis, a form of eye inflammation characterised by low eye pressure, redness and pain.
And let's just move her head. Uveitis is often a secondary change to the eye. You can see a haze that exists, and that's where there's a whole bunch of inflammatory cells that have actually come and invaded the fluid at the front of the eye.
Hi Miko, how are you feeling?
Just grab the broom and poke it.
At the Zambi Wildlife Retreat west of Sydney, Rob is cautiously approaching anaesthetised lioness Jaya.
I'm not going in there until she's in a very deep sleep. This is a serious matter. This is, she would tear us apart. And I wouldn't blame her. It's just what she does. It's her being a wild cat. So with a stick, I'm just making sure she doesn't react. So we're poking different areas around the eyes. She's not moving her head. Nothing is really reacting. I can go in now, but I'll play it safe. We'll take a net in, put that over her head and make sure that she's okay.
Rob needs to get a close look at a nasty tumour on the massive lioness's back.
If she gets up, it's a dangerous situation, really dangerous. People could really get severely hurt or killed by her. Okay, go. The older you are, the more risk with an anaesthetic. And what we don't know is what's a kidney function like, what's a liver function like, so it's a bigger risk. We don't know how things are. Right now she's asleep with one dart and we've got to be really careful. The longer they're out, the more worry you have of things not going well, so we've got to be really as quick as possible.
Watching nervously is Wildlife Retreat owner Donna.
When they're knocked out like that, I do get quite anxious. I'm always watching the breathing, making sure everything looks all right, because unfortunately I've done this for a very long time and I have experienced losing animals under anaesthetic. I guess it's like your child going in for surgery. You're going to be quite concerned.
Okay. Amy, scalpel blade, please. With her, truth, I just hope the sinus doesn't go down to the bone. If it's a primary tumour and we've got it all and it hasn't metastasised, in other words, gone to other areas of the body, we're out of jail. If it's metastasised, this will be the end of her. So the first thing is to cut a margin around this, and it's got to be big enough to make sure I've got the whole tumour out, but not too big because I've got to bring all this tissue together. Okay, another pot please. We'll put this in the pot, and again this will go off to the pathologist and we'll find out just what it is. The good news, the really good news, I'm very happy to report, it's not tracking down deeper. Hey, this is all right. I'm really happy with this tumour now because I've cut around it enough to get it all out, and I don't have to go deep to get it all out. So I am thrilled. Is she blinking or anything? Time, please. I don't want her out for too long. The longer she's under, the more stressful all her organs are going to be. It could really end her life. So I want to get through this as fast as possible. It will be, sorry, right, what rate we got now?
The heart rate's 68.
Right. That's the anaesthetic first. Can you deliver, give her 2 mils now.
Oh, I've got a stiff neck.
Oh, yeah, it is stiff because I can't crack it today.
In Sydney, Audrey and Alison are limbering up for their next patient.
Well, this morning I've got an absolute cutie for you, and guess what her name is? It's Piglet. Piggy! Yeah, oh, I love the name. She's so cute. She's a half Shih Tzu, half Maltese, and she just sits in your arm like a baby. I can't wait for you to meet her. She is adorable.
Atta girl. Hey, good girl. Good girl.
Devoted owner Brad is very concerned about 11-year-old Piglet's frequent urination.
Atta girl. Good girl. When I think about Piglet in pain, it breaks my heart. She's such a lovely little dog. She's a part of the family. We go for a walk, and every 5 or 10 metres she'd be stopping trying to wee. And sometimes she would, and sometimes she wouldn't. Like, she just couldn't get it out.
Hi, Brad. Hi, Piglet. Hi, Piglet. You look happy today.
So little Piglet is absolutely divine. She's gorgeous. She's got the most timid, perfect personality.
Can I have a seat back there? We've been seeing Piglet now for about a month. We found out she had a urinary tract infection, and on top of that, when we did an ultrasound, there were big stones moving around her bladder. So she was just really unhappy.
Piggy, my little cutie girl.
So this little girl, she's been through quite a lot. So 4 weeks ago, the ultrasound showed quite a few big stones in there, and she had an infection. How's she been going?
In the last couple of weeks, she's gotten a lot better. On the walks, every sort of 10 metres she'd be stopping trying to do a wee, and sometimes not. It all wouldn't come out. There was a bit of weeing on the rugs and on the couch. That's all stopped. Overnight, we have one of these out, and she's not using them overnight, so it's gotten a lot better.
The infection looks like it's gone, which is great. And that's probably why she's a lot more comfortable, because the UTI is really painful. We are still a little bit concerned because there's quite a lot of blood in the urine.
From a young age, Piglet had crystals in her bladder or in her urine, and over years they've developed. We've tried the urinary food quite a lot. It's helped, but then it's gotten worse again, so this is where we're at now.
Those stones that we saw in the ultrasound, they might be bouncing around and still causing a bit of discomfort or bleeding. So today I'm quite keen to check her out, do maybe another ultrasound, and maybe again x-rays to confirm if there's any stones or smaller stones still in there that we might have to take out. We want to feel her bladder, we want to know if she's peeing normally, and I also want to pop an ultrasound probe on and see if there's any stones in there.
Can you press the little freeze?
And the camera button, right? And then the freeze button again. Thank you. Brad is actually a great veterinary assistant. We've got him freezing the frame in the ultrasound, helping us take pictures of it. There's definitely still some in there, one big one.
You want Brad to freeze it?
You freeze it?
And straight away we can see the small bladder with a large stone floating around in it. When we move that probe around, we actually find another stone. Could potentially rupture the bladder, or if some of those stones break off and go down the urethra, it could potentially rupture further down as well. We'll do an x-ray, that way we can sort of count how many there are and then make a plan for surgery today. Hi.
Okay.
Get those stones out.
I think Brad may have been a little bit shocked that the stones were still there. I think he was a little bit disappointed. Nobody wants to go to surgery, but in this case, it's a must.
I'm going to take her straight to the hospital, get her prepped for surgery, and then get her home tonight.
Okay, great.
Okay.
All right.
Say bye to Dad. We'll let you have a last cuddle. Piglet is absolutely obsessed with her dad, Brad. She's like snuggling into his shoulder, nuzzling into his neck. Alrighty.
Here we go.
When it gets time to go, she just runs to him and just hides behind him.
Daddy! Oh no! You make me feel bad.
Come on.
She's a real daddy's girl.
Thanks very much. Yep, we'll see you
Give
soon.
you a call as soon as she's in recovery.
She's a part of the family. She's just always there. Yeah, couldn't imagine life without her. Okay, see you, Pig. See you soon. Okay, bye.
Good morning.
In Bondi, Miko is now fully awake and Lynn is waiting anxiously to hear the results of her eye examination.
Good job. Good job, kiddo.
Hello.
So good. There is no corneal ulcer, right? So the total cornea is completely fine.
Oh, good.
She does have some uveitis there, so that's where the pressure in the eye drops. And you notice that the eye itself is a little bit hazy.
Yeah.
And that's just purely for the fact that there's been some inflammation there. What I think's happened is that the little border collie has actually got his little nail stuck and actually scraped an ulcer on the inside of the skin, where it's essentially gone. But at least it's not the eye.
Yeah,
It's the third eyelid that's
so
the
do they
problem.
repair all right?
It'll be fine. She's going to have some medication to go home with. So she's going to go home with some anti-inflammatories. It's also a pain relief, so it means that I can correct her uveitis and it's just going to not be so painful. The second part of this is you've got 2 little drops here. You've got 1 antibiotic and you've got 1 lubricant. Lastly, what I would like to do is I would like to get her back every couple of days because I need to make sure that this is going in the right direction. This eye is still vulnerable. It still very much can go the wrong way. But in saying that, I'm hopeful that if everything goes to plan, within the next week that eye is going to be back to normal.
You're a good girl. Good girl.
Oh, thank you for my kisses. That's nice. See, oh, bless you. I feel for her so much. I can just feel how much emotional turmoil she has. She makes me feel a bit tearful.
Yes.
In London, Scott is struggling to make any headway with an extremely anxious and aggressive young Rottweiler.
Why do you think that she feels this sense of protectionism towards you?
It's a pack instinct, isn't it? So
could we just see if she's Mr. Hyde when you're here, and maybe she's Dr. Jekyll when you're not?
Not, yeah.
That's it.
Thank you.
Thank you.
Scott's about to find out if he's being foolhardy, staying alone in the room with Daisy.
Hi. Oh, where's that puppy? I know, Mummy will be coming back. Don't worry. Now you've got no one to protect, have you? So now it's just me and you, missus. Let's come and sort this out. Come here. Come here. Good puppy. Come here. There's a puppy. Oh, what a lovely girl you are. There. Such a sweet girl. Oh, gosh. The transformation of this dog was epic. Daisy went from being protective of Tracy and constantly giving me the side eye and yelling at my face to actually going, oh, okay, Mum's gone, I might as well be friends with this guy. You're lovely, yes.
Daisy's change of behaviour is astonishing, and Scott wants to seize the moment and check her worrying paw.
Look. So
am I ignoring her?
Yes, please. Well, she even gave me a kiss and everything.
Yeah. It's just that immediate.
Yes.
I'm getting used to. That's what I'm saying. It was time and getting her used to people.
Yes.
And that's all it is, I think, with her. Hopefully.
With Daisy finally calm and relaxed, Scott's giving a quick injection to sedate her.
It's done. What a good girl. I know, horrible thing.
His first priority is trimming Daisy's badly neglected nails.
There we go.
Now he can safely get a close look at her paws.
Gosh, so look at that. It's all full of pus.
Okay, baby.
Oh, poor baby. Gosh, no wonder she's grumpy. I'd be grumpy.
Yeah.
She's got some really sore paws. They're in a really bad state, not only on the surface where there's scabby lesions that were discharging a little bit, but underneath, every single pad had pustules that were leaking a sort of pussy discharge and a bit of blood, and that will absolutely be contributing to her bad behaviour. Just while she's being good, I'm just going to do the scrape here.
This skin scrape will allow Scott to quickly identify what's causing Daisy's problem.
The diagnosis for Daisy's condition is pododermatitis, so basically inflammation of the skin around the feet. There may be an allergy at the root cause for Daisy's very sore pads. So we took a sample of blood. We're going to be sending that off to the lab to get a full allergy panel which checks for things that she might be touching as well as things that she might be eating. So she's got two issues. She's got the medical issue, which we are addressing, and we're going to have her on some medication and some anti-inflammatories just to cool down the soreness.
Yeah.
But of course, we do have this behavioural problem. And although I think the medical problem does affect the behavioural, I don't think that they cross over completely. It's like a Venn diagram.
Yeah, of course.
I think there's some crossover in the middle. Yeah. But also, my question to you is, how do you feel about the use of something like antidepressants to try and manage her anxiety as you're going through the behavioural modification?
Yeah, let's do it. You know, it's just, it's a no-brainer really, isn't it?
Well, let's put all this in place. Okay, well, Tracy, thank you for bringing it to see me, and it's been a real pleasure.
Yeah, thank you so much.
You're
we
so
knew
welcome.
you was the guy for the job, didn't we? I think with the antidepressants, it's a good idea. I never really thought of it really for a dog, but if it takes the edge off of it and we get her there quicker and we get her to a better place, then yeah, I think it's an absolutely brilliant idea.
All right then, we'll see you later.
Thank you, Scott. Thank you very much.
And then you're going to go out this way? Good girl. There's the exit.
Thank you.
See ya.
Bye-bye.
Bye. There we go. Oh, man. Oh, gosh. After that, I think I need a nap. Oh, stressful.
Take her straight to the hospital, get her prepped for surgery, and then get her home tonight.
Okay, great.
In Sydney, Audrey and Allison's patient, Maltese Shih Tzu Piglet, needs major surgery to remove painful bladder stones.
Nobody wants to go to surgery, but in this case, it's a must.
If her bladder stones aren't removed, Piglet will suffer from chronic pain, and parts of her urinary system could rupture with fatal consequences.
Hello. All right, let's take some blood. We want to take some blood, just make sure she's safe for anesthetic, pop her onto fluids, and then get her ready for cystotomy, which is basically when we open up the bladder to take the stones out. When you are happy, I will run her into X-ray.
So we do an X-ray on Piglet, and this is another form of imaging that we can see whether there's any more stones than we didn't see on the ultrasound.
X-rays.
Oh my God.
Wow, look.
Wow. And it is very dramatic. That is 2 huge stones. It must be the bigger one that you picked up. They're massive. They're almost the size of half of her bladder. And it really does take your breath away because you know they're there, but when you actually see them on the X-ray, it's quite shocking.
It just explains all the signs we're seeing with her. Those stones are never going to dissolve. They're such a big size in comparison to her bladder, so we need to go in and get them out.
But before the twins can start surgery, there's a problem.
Oh, has it? The heart rate's dropping. What is it now?
Can you get me some flusher?
Do you want me to turn her off and give her some fresh flush?
Yes, please. A couple of minutes into the general anaesthetic, her heart is going low and ours is going really high.
It will be, sorry, right, what rate we got now?
At the Zambi Wildlife Retreat, Rob and his team are suddenly on high alert, with lioness Jaya showing signs of waking up.
Give her 2 mils now. She's breathing up, she's coming awake, and that becomes a danger for everybody, including Jaya. So time to give her a little bit more anaesthetic so we can finish this surgery off and then give her the reversal and get out of here. Is she blinking or anything?
Rob has just removed a nasty tumour, but is now under pressure to close the wound as quickly as possible.
Done. We're out of here. All right, guys. Surgery's ended. Let's get everything out of here. I don't want to leave anything at all. I'll be the last person out. We'll give her the reversal and then we'll observe her from the outside. If she sinks those into you, you're gone. She's a very serious animal, aren't you, Jaya? You're a beautiful animal. Best case scenario is that, well, it's a benign tumour, or if it's a malignant tumour, we've got it all, it was a primary, and we don't see it again. Just want everything to go right here. This is a real tough time. Fingers crossed for Jaya.
The heart rate's dropping. What is it now?
Can you get me some flusher?
Do you want me to turn her off and give her some fresh flush?
Yes, please.
In Sydney, Piglet's heart rate has dropped dangerously low, just seconds before Audrey and Alison start surgery to remove life-threatening bladder stones.
Do you want to just put her off her back for a minute? We do a lot of older animal general anaesthetics, and we do every step we can to make sure it's as safe as possible, but there's always a higher risk, so there's always a higher amount of stress. It's coming up. It's coming out. Yeah, I'm happy with that. Finally, we get the heart rate under control. She seems pretty stable.
Sigh of relief.
Okay, ready, go.
Good to cut. Good to cut.
Good to cut. So we've made an incision into the abdomen and exteriorized the bladder, and we can see the bladder doesn't look normal.
Look how angry that bladder looks.
I can actually feel the stone in there. Right there's one. You see that? Oh, you can see it. And then another one over here. Yeah, it's huge.
Oh, here we go. Oh my goodness, look at that.
Here's one. It's a bigger one, isn't it? Put some traction for me.
Wow, look at those stones. That's like almost the whole size of the bladder. So it's a huge success. That surgery went really, really well, better than we expected. There were only 2 stones in there, so thank goodness, but they were huge stones. So it's really great to know she'll be feeling a lot better.
Piglet will now be much more comfortable.
Oh, that's so warm in there. Can I come in?
2 hours later, an anxious Brad has come to collect his little girl.
I'm feeling a little nervous. Yeah, hope everything went well. So yeah, just here wait and see, and yeah, hope it all went well.
Okay. Hello. So we're still recovering at the moment. We're just going to try and get her temperature up to about 37. She drops quite low because she's so tiny, and she's still quite out of it. So while she's waking up, I thought I'd show you this.
Oh wow.
Give it a shake and feel how heavy. I know, right?
Oh, the poor thing.
Yeah. So I'll let you play around with that while we get your girl ready. So hang tight, we won't be too long.
That's amazing. I can't believe that those were in there. Like, they're sharp, and yeah, they would have been bouncing around. That's nasty.
Okay, look who's here. Look at those ears
Look
go.
at those ears.
Where's Eddie? Where's Eddie? Not that way.
Piggy. Hey, pig.
Oh,
still unsteady on our feet. We've only just woken up, okay?
Hello, Piggy.
So the next few days are critical. We want to make sure that she's eating and drinking, but on top of that she can go to the toilet normally. That's number one game here. And if she can, then it's a bright future for her. She'll be able to urinate normally, she'll be infection-free, and hopefully just live a long, happy life.
Well, Dad brought your bed. Isn't he the best dad in the world?
So happy, really happy, yeah. I'm really glad that they got these things out. You know, when she goes for those walks and she needs to go, she'll be able to go. Just, oh yeah, I'm over the moon.
All right, take care, Brad. We'll
Thanks
be in
very
touch.
much.
All right, bye-bye, Piggy. Be good.
Bye, everybody. Thanks very much.
See you.
A month after Kate treated Miko's scratched eye, the Australian Shepherd is fully recovered and back living with Mum Izzy.
Good girl.
At the Zambi Wildlife Retreat, there's good news. Jaya's results came back benign, and she's now fully recovered to rejoin her partner, Manti.
Hi, I'm Dr. Danny. If you enjoyed this video, then please remember to subscribe to the Bondi Vet YouTube channel. Click on the screen now to continue watching more great content.